Good afternoon, everyone. I'm really looking forward to this session, during which we'll be discussing the role of academics and professionals in the fight to end TB. My name is Jess Potter, and I'm a respiratory and TB specialist doctor, researcher, and activist. And I co-chair the network UK Academics and Professionals to End TB, alongside one of our speakers today, Kerry Millington. I'm joined in my role as co-chair today by Austin Obiafuna, who's the Executive Director of the Afro Global Alliance and former National Coordinator of the Stop TB Partnership. UKAPTB was set up to contribute to the global work of ending TB by coordinating academics and healthcare workers in the UK to advocate for accountability and progress towards the goals agreed in the political declaration at the UN high-level meeting in 2018. We've already heard earlier in the conference from Nick Herbert, member of the House of Lords in the UK and former Conservative MP and current chair of the Global TB Caucus, about the role of parliamentarians in TB advocacy and action. During his talk, he highlighted the lack of accountability built into the last UNHLM political declaration. As a network, UKAPTB aimed to hold the British government to account, pushing for financial investment and policy change that will contribute to ending TB. But are our voices as academics and professionals important, and how are we going to affect change? Today, we're going to hear from Virendra Sharma, sitting Labour MP, Member of Parliament for the UK and co-chair of the All-Party Parliamentary Group on TB, about whether or not he thinks we have a powerful voice and our role in policy change working together. We'll then hear from co-chair of UKAPTB, Kerry Millington, about the history of our network, strategies, challenges, and our hopes for the future. And finally, we'll consider whether this model can work globally. Austin, co-chairing this session, will share his perspective from Ghana, and we'll hear from Yannicka Hauser, a specialist in TB advocacy, who will give us a guiding hand towards the future. Please do post comments in the chat and add questions to the Q&A as we go along, and we'll address them later. You'll also note that there is a letter to sign up to. We're writing to the President of the UN General Assembly to try and ensure that the voices of healthcare workers and professionals are included alongside affected communities in the run-up to the next UNHLM on TB. So without further ado, I'll hand over to the first speaker.
Without the tireless efforts of academics and professionals working across global health, we would have zero chance of eradicating the world's deadliest infectious diseases, including TB. Yet their voices are not often prominent in the world's parliaments. This disconnect means that parliamentarians are missing out on vital intelligence in the race to solve the world's biggest global health challenges. We need to find more opportunities, both formal and informal, for collaboration between MPs and those working on the front lines of the fight against TB, whether they be health workers, professionals, or academics. Doctors, nurses, and other health professionals can serve as powerful advocates for people living with TB in our communities. They have invaluable knowledge of the real world impact that TB has on our constituents because they devote so much of their time and energy to treating it. They get to know TB patients and their families. They know the correct drug regimes and treatment procedures. And they can see the impact that TB, when left untreated, can have on people. They are true experts, and as such, they also know what needs to change, where additional funding is required, and where new medical tools are needed. If any government is to make meaningful policy changes on TB, the perspectives of these health workers should be central to the policy formation process. And as such, we need to find more ways to channel those expertise into the right parts of government. I think this perspective is particularly important within the United Kingdom, as many still regard TB as a disease which only affects poorer countries. Yet TB cases are on the rise in the UK, and we need new champions and advocates to ensure that those people living with TB are sufficiently represented and accounted for within the mechanisms of government. Academics, for their part, are fundamental to the process of discovering and researching the new tools and medicines necessary to eradicate TB by 2030. These processes take a long time. We have not had a new TB vaccine in over 100 years because it is such a difficult and costly process. Yet the last few years have seen some promising advancements, such as the BPAR regime, which can drastically reduce treatment times for drug-resistant TB. We, as parliamentarians, need to be promoting these new tools to our governments. But this requires academics and parliamentarians to work more closely together, sharing the latest evidence, intelligence, and test results. This works both ways. Promising new treatments can benefit from government funding, which MPs can help to secure by advocating directly to ministers. In the UK, we have taken steps to try and break down these silos. The UK academics and professionals against TB network have been really successful in advocating to MPs on behalf of their patients and institutions. The all-party parliamentary group for global TB, of which I am co-chair, have been working with the UKAPTB, bringing them into parliament to meet with MPs and ministers to give their first-hand accounts of their fight against TB. Over the coming year, we will be looking to organize more opportunities for collaboration between the APPG and the UKAPTB, especially as we count down to the 2023 UN high-level meeting on TB. It is imperative that we get the perspective of health workers and academics into the post-meeting declaration, because it will impact so much of the fight against TB over the next 5 years. But for this to happen, we need to continue to break down the silos between stakeholders across the TB sector. So if you are a TB health professional or academic, engage with us, parliamentarians, because ultimately we all want to make sure TB is eradicated by 2030.
Good morning, good afternoon and good evening, and thank you for joining us today. My name is Kerry Millington and I'm from the Liverpool School of Tropical Medicine. And alongside my colleague Jess Potter, who is co-chairing today, we co-chair the UK Academics and Professionals to End TB Network, which I'll refer to as UKAPTB going forwards. I declare that I have no conflict of interest to report. So our aim is to contribute to the global work of ending TB by coordinating the academic and professional communities to advocate for commitment, accountability, action and progress towards ending TB. UKAPTB is a group of academics and professionals working in the field of tuberculosis. We provide a point of contact for UK parliamentarians, government departments, civil society and affected community organisations and other bodies that wish to draw on our wide-ranging expertise in delivery of TB services nationally and internationally and our TB research activities, where this is not already met by existing expert advisory groups. We connect and exchange ideas to strengthen and facilitate further effective collaboration, and we advocate on issues related to TB prevention and care in the UK for political commitment, accountability, strengthening of evidence-informed policies and programmes, and for more investment in TB research. With the support of our Secretariat Results UK, UKAPTB was formed in December 2017 ahead of the UN high-level meeting on TB in 2018. UK organisations joined others at this landmark meeting. Post that meeting, there was a collective statement from UKAPTB that identified 7 areas for action where academics and professionals can play a role, which are listed here. And this includes ensuring effective implementation of the commitments made, working within an accountability framework to track clear and specific targets for research and in particular applied health research, providing a strong evidence base to guide investments to maximise health gains with rational use of funds, situate our work within wider efforts to strengthen health systems and engage with the multifaceted risk factors for TB, advocate to close the funding gap for TB research, better engage with stakeholders not only in the dissemination of research, but also in defining strategic plans and investments for research, and ensuring that stakeholders commit to evidence-informed decision-making. With 1 year to go to the next UN high-level meeting expected to be in September 2023, we are coming together again as a network to reflect on progress and gather our thoughts on key messages that we would like to see in the next political declaration. The rate of TB in the UK is below the WHO definition of a low incidence country, but noting that this data was cautiously interpreted given the COVID pandemic and the impact that this may have had on access to and engagement with health services, where TB is often now manifesting in late presentation and is more widespread. But like TB on a global scale, TB locally is often concentrated in those with social risk factors, from our more deprived communities and in people born outside the UK and living in urban areas. The UK Health Security Agency, along with NHS England, are committed to meeting the WHO TB elimination targets by 2035, as outlined in the TB Action Plan for England 2021 to 2026, which is a roadmap for COVID-19 recovery and year-on-year reduction in TB incidence and in UK TB transmission, and this is the figure on the right-hand side. But we can see from the graph on the left-hand side where the red line is, we are, despite a fall, we are far from reaching those targets and there is work to be done. This graph shows the desired decline in global TB incidence to reach the 2035 targets. The current global trend, the red dotted line, is way off. And as COVID transforms the world, we face ongoing global crises in changing global politics, the effects of war, rising cost of living, fake news, increasing poverty. And conditions of poverty is where TB thrives. This is the context in which we must work harder than ever to rid this world of this curable disease. The COVID-19 pandemic has shown us that when we invest and work together with the scientific community, we can save lives. Connecting our professionals and academics with each other and with other stakeholders in the UK, along with our global partners, ensures that we work together across disciplines, across organisations and across sectors through trusted relationships for action, accountability and progress towards a TB-free world. This is a unique model of academic and professional communities working together to support political efforts, which we hope to support the replication of in other countries. Thank you.
Thank you, Chair, for introducing me. My name is Austin Arinze Odiefuna, Executive Director of Afro Global Alliance. I'll be speaking more around harnessing the political power of academia and professionals to end TB. And I'll be relating it to the Ghana experience. First of all, taking cue from the 2018 high-level meeting, we realized that everybody has a role to play in the TB response. And we've made it in such a way that we leave no one behind. And that's actually a very strong slogan for the civil society, but it's applicable to every sector, especially the academia that helps in bringing out the evidence, supportive evidence to make sure that certain interventions are piloted, either scaled up or maintained within a TB program. We have not really taken enough steps to utilize all the resources that the academia and professionals present in TB response. And the reason being that there's been a lot of setbacks in terms of coordination at country level. We know that the academia have been very, very supportive in terms of being part of the overall coordinating mechanism, in countries to make sure that TB response in countries are given the highest priority. If you look at Ghana, for instance, Ghana has got a very strong academia participating within the National TB Advisory Board. They give advice to the program on how things should move, things like the new regiment, things like the 3HP, TPT. The academia has been very strong in helping to roll out and also, put a little bit research behind it just to make sure that whatever recommendation or adaptation process that is happening are being harmonized and also good for the country context. I must say that the academia also have been part of the National Stop TB Partnership in Ghana, helping to put a strong evidence face to the entire TB response, especially around the civil society engagement. So for me, I would say that we've not reached that potential in terms of how to make sure that we harness that political power of that academia. Probably they are a little bit quiet or very keen in staying in their comfort zone than coming out. But I think the program needs to be proactive because you need to connect all the dots, make sure that you share that egalitarian platform that will allow everybody to speak as experts within their own sector or their own area, And the academia has been very, very supportive in making sure that lab technicians are trained, making sure that provide a lot of evidence, for scale up of certain piloted activities. But we still need to get to that level where we can say that the academia are advocates as well. Because just bringing out all this research evidence doesn't necessarily mean that they are doing the advocacy, because we need to have an advocacy mind around it in order to promote some of these interventions. So with the Ghana experience, we are doing well, but again, we need to do more. We need to improve. Probably by the day that I see academia speaking the advocacy language that public sector usually do not like, but this is with fact, with evidence. I think then I will say that yes, we've really reached that milestone to say that yes, the academia have been really, really pushy in terms of helping public sector understand the reason why TB response should be improved. Thank you.
Hi everyone, my name is Yannicka Hauser. I helped set up the UK network that Kerry's spoken about today when I worked at Results UK a few years ago, and have spent the last 2 years working with a Royal Medical College that represented the views of academics and professionals to mental health policymakers in the UK. I've recently made the move back to global health and have been doing some thinking about how we can harness the voice of academics and professionals in that space. So really grateful to be part of today's session. So historically speaking, the assumption has always been that academics and healthcare workers would make the world a healthier place through the work that they do in universities and health clinics alone. But recently we're seeing research funders put much more emphasis on this idea of impact. Though the advice that they give around evidence-based policymaking often relies on having a really motivated audience, trusted relationships with policymakers, and research outputs that are immediately policy relevant. But we also know that higher level drivers often determine the level of impact that you can have when you're in those jobs. Things like the policy and funding of national TB programs, how much money your government invests in research and development, the regulatory environment, and so on. And that's one of the reasons that we're seeing more academics and healthcare workers, including the big institutions that represent them, increasing their advocacy and campaigning capacity, and why we want to support academics and clinicians working in global health to really do the same. We know that policies change when a politically salient problem meets an implementable proposal for a solution with sufficient decision-maker commitment to overcome that political gridlock. And we also know that those three things are often quite far apart, and you need a sustained and targeted campaign to bring them closer together. And we saw that in the run-up to the last UN high-level meeting, when campaigners made the problem politically salient to those that were involved in the negotiations. There was a really clear set of asks that everyone agreed about, and we worked together to campaign and advocate towards a really clear deadline, which helped us ensure there was the political will to get us over the line. Looking at the next UN high-level meeting, though, we know that bringing those strands closer together is going to be much more difficult. The pandemic and its economic impact have made TB less politically salient, and will also be competing with high-level meetings on UHC and pandemic preparedness. We also know that the next UN high-level meeting is going to be about taking stock and adjusting course to get us back on track, which is a much trickier ask than a high-level, ambitious and aspirational political declaration alone. And the last few years have also shown us that you need really, really robust follow-up engagement with policymakers in country, because many of them aren't actually involved in the negotiations at the UN General Assembly. In that much more difficult context, mobilising the voice of a community that's been less engaged in advocacy can be really powerful. And academics and healthcare workers have a really unique set of skills and assets. Working with them in the UK over the last 5 years, I've seen firsthand how they're able to access powerful but otherwise uninterested decision makers, how their presentation of a problem is often perceived as more convincing, and the solutions that they push for are deemed more reasonable than those that might be presented by civil society advocates or survivors. From the perspective of a campaigner, you can view that as incredibly frustrating, or you can view it as an opportunity to partner with a really powerful constituency. From the perspective of an academic or a healthcare worker, you can view it as a really scary proposition to leave your comfort zone, or as an opportunity to reinforce your credibility and secure the policy and funding environment that you need to do your job more effectively. And I think that's the most important point that I want to make. This isn't about turning academics or healthcare workers into hardened activists, though I will never stand in the way of anyone that wants to do that. It's about recognising the unique advocacy impacts of academics and professionals who are engaged in the policymaking process, and about working together to harness that for our collective benefit. And so when I think about all the influencing opportunities over the next year and beyond, it's important to remember that it isn't about doing everything all at once. We know that academics and healthcare workers are busy people, and so we need to think really carefully about what key messages they are able to convey most impactfully, what key policymakers they can access that others might struggle to, and how they should shape that engagement. And in that context, coordination is so important. I think some of the reasons that the UK network has been so successful is that it coordinates academics and healthcare workers around a really specific set of asks. It offers safety in numbers so that no single academic or healthcare worker is going it alone. And it's supported by local civil society and Results UK, who help them stay plugged into national policy discussions and help manage some of the work that comes with advocacy that we all know. So there's clearly huge potential here, but we also know that the specific dynamics of a political environment and the research landscape in different countries will have a huge impact on the willingness, the capacity, and the impact of advocacy by academics and healthcare workers. And so I'd love to hear from you today. What are your experiences? What are the barriers to doing this kind of advocacy well? What are the key opportunities in your country? And how can that work be supported? And how can we all work together to build on the successes of the UK model for global health around the world? So really keen to hear the thoughts in the discussion that's going to happen shortly. Or if you'd like to get in touch with me directly, my email address is also on screen. And I'll hand back over to our chair.
Thank you so much, Yannicka. I can only see myself and Kerry right now. Oh, here we go. There's everyone else. And I think Austin might be having some technical issues. So I'm going to direct one of the questions straight towards Yannicka. If academics or others had 30 minutes a week or month to do something in this space, what would you suggest they did, at least to get started? Great question. Yannicka.
Very good question. So I think the first thing I would probably recommend is to try to find the people that are engaged in the policy discussion in the country that you're working in. Just to make sure that the thing that you're focusing your efforts on makes sense within the policy making cycle, within the investment making cycle, within the conversations that are happening between civil society organisations, the National TB programme, and relevant government ministries. So I think that's probably number one, just to get a steer of what is most helpful in the country that I'm working now. I think another really quick thing that academics and healthcare workers can do is try to build a relationship with their local parliamentarian, both for your home constituency and potentially the constituency that represents the academic institution or hospital or health clinic that you work in, and just describe the work that you're doing, why it should matter to the parliamentarian, it's often really difficult to convince parliamentarians to care about TB, and having that kind of personal connection of a constituent can be really powerful. And again, plugging that relationship into the work that civil society organisations are doing can be really important. And then finally, I think one of the key lessons from the UK Academics Network is the power of kind of coalitions and working together. So it's not just one academic or healthcare worker talking to policymakers, but a group of them who are kind of speaking collectively. So I think the other thing that I would probably do is send some emails to other people that you think are similarly minded, are interested in policy engagement and advocacy, and see whether you can't get a little group together like UK Academics and Professionals to End TB, which started as, I think, an email chain of 5 or 6 people and has grown into a network with many, many more people on the mailing list. I don't know whether there's anything that I've missed, Kerry or Jess or Austin.
Just to add that I think from the policymakers' perspective, it's quite nice to having that point of contact. So if they have queries or they want to find out information, they can come to UKAPTB and then they can be signposted to the relevant people within the network. And I think they have certainly appreciated having that kind of, right, this is where we need to go, and they make that point of contact, and then they have that help in being signposted to whatever's relevant to the question or query they have.
And I guess just to add a very specific example from just this week, we've been trying to address problems with drug shortages for TB medications across the country, and UKAPTB, that came to our attention. We gathered together some interested parties, or interested parties came to us, and we were able to then quickly help contribute to putting that letter and that issue in front of parliamentarians who can put it up the agenda of people who can actually hopefully do something about that, and ensure our patients have ongoing access to the medications they need. I'm going to direct the next question towards Kerry and Yannicka. Funding for all areas of TB is a challenge for implementation and national policy change, as well as for R&D. So what's the language that works for mobilising funding, either domestic funding or international funding? I think the $1 million question.
There was a little silence where Kerry and I worked out who to take the bullet first. I mean, I think there's some basic stuff around kind of how you convince people to do things that you want them to do, thinking about what motivates them, and kind of trying to frame your problem statement and solution within those settings. I think the idea that there is some magical way of phrasing the problem of TB and the lack of funding for it that will have decision makers suddenly change their mind is potentially a bit of a red herring, in that I'm not sure that it exists. It's, for me, it's that earlier in my presentation I had a little graph of the kind of the salience of the problem, the solution, and the political will. And I think you have to whittle away at all of those in order to get the funding that we need for national policy change and R&D. And so, you know, the voice of academics and healthcare workers has a really, really key role across those three pieces. But I don't think it's necessarily about kind of coming up with entirely new ways of phrasing the problem.
I think just echoing Yannicka's first point there is that you have to understand where the funder's coming from, and frame your problem within their strategic priorities that they've set, and identify windows of opportunities for funding. And then in the question you talk about how you can have funding at the national level, but there's obviously a big global push to invest more in TB research, and there are political commitments there too. So how can you perhaps also link into advocacy work that's being done at the global level?
And actually, moving on to the next question, which I think relates to, Yannicka, your graph again, the gap and narrowing that gap between the saliency of the problem and the political will. it says, someone's asked, what are the panelists' opinions on the lack of evidence-based guidance on socioeconomic support for people with TB and no plans for a nationwide TB patient cost survey in current UK HSA strategy? And I know that I think this question has probably come from Tom Wingfield, because I know that this is something that he's particularly interested in, and it's so important that we've heard across the conference about the impact of catastrophic costs. And in the UK, this is an issue. I think historically we thought perhaps it wouldn't be because we have a socialised model of healthcare and a welfare system, but it is increasingly an issue, and particularly in the context of the cost of living crisis that we are experiencing in the UK right now. I wonder, Yannicka, if you have any advice on how we can narrow that gap, particularly relating to this issue. I certainly think that UKAPTB, this is something UKAPTB could again try and harness the support of parliamentarians on this issue, particularly in its relationship to public health.
Definitely, and I think this is one of those problems that emerge in the policy landscape that are really, really into the nitty-gritty of policy making and decision making that happens within government bodies. The process that got you, I mean, I wasn't involved in the conversations at this point, so I'm kind of thinking about it from a completely outside perspective. But you know, the conversations that would have happened at UKHSA about whether or not to do these surveys and so on, those conversations are probably ones that are inaccessible to lots of civil society advocates, but that are accessible to healthcare workers and academics who have, you know, roles consulting or being on working groups that that kind of support the decision making within the national TB kind of program equivalent, and they're coming together with civil society advocates, thinking about, okay, what are the barriers that have, what are the things that have led to that decision? How can we dismantle how can we kind of argue against them? And then thinking also about what political levers you can use, because it's again one of those things where a well-targeted question from an MP can move a lot of levers around decisions that that kind of government policymakers may have thought just kind of go under the radar of decision makers. So yeah, I think this is definitely one of those spaces where collaboration between academics, healthcare workers, and civil society is really, really helpful. And then kind of speaking to allies in Parliament is a key lever.
I think this comes back to kind of having those well built up trusted relationships, so you can have a dialogue with these players to see why these things aren't happening and try and understand why they're not happening, and if it's an awareness issue, and how then the evidence can be presented to put this on the table, or is it because of other reasons, and therefore you might need to, as Yannicka suggests, use other levers and political levers to kind of influence perhaps a change in the direction. But I think certainly having that open dialogue is a starting point.
Thank you both. I think another question that's come up really is the crux of why we developed this session and proposed it in the first place. It would be good to hear, this is the question, to hear how many of these organisations exist in other countries, and if there is a way that UKAPTB could pass on some learnings for other countries interested in setting up similar groups.
Do you
Kerry,
want to take that on?
Both
thinking behind that, Yannicka?
Kerry, do you want to go first? I feel like I'm always jumping the gun at the moment.
No, I think, and we have got thinkings, and we have been approached by others to kind of try and join our network, but we are very much advocating that it is the country network that needs to come together to influence their own governments. But to try and do that piecemeal, country by country, could take time. So at the moment, we're currently exploring how we could provide support and share experiences and learnings from our setting. And then ultimately, that can be done across a wider global network that everybody could learn from each other countries' experiences. So we're looking at how we can kind of provide that support on a more global scale to inspire and then influence and share learnings and experiences with other countries as they then set up their own networks within their own countries to link into the parliamentarian process.
Definitely, there is so much learning that can be shared from the experience of UKAPTB. But as Kerry said, in order for those kind of coalitions to be sustainable and to be kind of built around local capacity, capability, and the priorities of stakeholders in country, I think it does really need to be something that is owned in country, where it comes to a specific kind of national network. But that space for kind of global knowledge sharing, global coordination around key international moments like the UN high-level meeting, regional summits and so on, I think is a really big opportunity. And actually Jess mentioned this at the start of the session, but UKAPTB are organising an international sign-on letter to the President of the UN General Assembly and the co-facilitators of the UN high-level meeting next year, to kind of try to ensure that the voice of academics and healthcare workers is included within that process. I'll copy the link over into the chat shortly. But Campaigning Global Health has been supporting that effort, and there's an option if you sign up to add your signature to the sign-on letter. There's an option at the bottom of the email to express your interest in kind of being kept in the loop about opportunities to engage and support policy engagement and advocacy efforts at various levels. So we'll make sure to kind of reach out to folks. And then obviously there's also, we all have email addresses. So if it's something that you're really keen to try to take forward in your context, then please do reach out. And this is an area of work that's super exciting, and there's so much opportunity really. So yeah, I'd love to find more allies that can help us take this work forward.
I think our final question said, asked whether or not we have any reflections on how healthcare workers and academics link up with policy advocates in country, as from personal experience, this mix can be very effective. And I guess just to add my own experience of this, I completely agree that that joining up is really important historically, particularly as a healthcare worker myself and an academic. That kind of pushing for policy change, whilst our research work is always aimed at impact in terms of changing policy, the lobbying that's associated with it is not something that comes naturally. And so we do need people who are experienced in that area, like Yannicka, and we're working very closely with Vinny from Results UK, who can help us with building those networks and those relationships. And also just to add that this really importantly has to be done alongside and with affected communities. I recognise very much that historically, the voice of academics and professionals has been often a driving voice, rather than listening and centering the experiences of people affected by TB. And this is really just to join us up, so that we can work more effectively together to push to end TB. Yannicka and Kerry, any other reflections on how we can, on your own personal experiences of bringing this together? Do you want to go first, Yannicka?
Sure. I think, as you said, something that's really, really important when you're trying to foster those partnerships is to really have a strong understanding of the perspectives, experiences, priorities that different people come to the table with. I think there's the tensions that can sometimes emerge when we attempt to work with partners that come from completely different sectors, is that we people can get frustrated at the fact that the professor isn't suddenly a burning heart protest t-shirt wearing kind of activist, but the real value in the collaboration comes from kind of understanding that the voice that these stakeholders have are different, that the decision makers that they can access are different, and that they have different stakeholders to consider. So, understandably, a community healthcare worker might be a little bit more reticent to really openly criticize their employer or the funder of their research, but they, have a really strong understanding of what's happening on the ground and can present that in a really credible way. They can support civil society in analyzing swathes of data, in supporting them in conducting research, in speaking to policymakers that civil society activists might not be able to access. So I think it's really about coming to the table, understanding different perspectives, and working out where those opportunities to work together to maximize our impact lie. And just taking that work forward. And I think UKAPTB has been a really great example where the healthcare workers, the academics, the affected communities, and the civil society organizations have come together to really leverage each other's best parts.
And echoing that is that, you kind of come together to be bigger than the sum of your parts. And it isn't always that it's always the kind of same people working on the same activities. It's very much understanding, for this particular activity we want to do, whose strengths can we draw on within the network that we've built up over time, to identify which are the stakeholders that we should be engaging with for this particular activity, to try and make it work. And so it's kind of thinking through that for each activity and how best to do it, and then learn from each other. We're not all experts in policy advocacy, so how can you work with others, or how can you translate and exchange the knowledge and be that bridge between science and policy, and get the evidence into the language and the formats and the timing of when it should be presented to policymakers, or get them engaged, of course, with early ideas in research, so they can be part of the process early on within research in designing the questions to make sure that they're going to be relevant.
Well, I think that we've come to the end of our time, or slightly overrun. So thank you very much to all of our speakers. I'm sad we didn't hear more of your voice, Austin. I'm sorry about the technical difficulties that we've experienced, but at least we got to hear your presentation, your talk. And thank you very much for all of the great questions. Please do sign up to the letter that's posted in the chat, or check out Twitter, where there'll be a link to the letter as well. And thank you very much for attending. Bye.
Thank you.
Thanks, everyone. Bye.